Hey everybody, Doc Parsley here. I wanted to address something slightly different today. I've been doing obviously a lot of my own videos. I've been going on other people's podcasts and video blogs and things like that. And we've talked quite a bit about the virus, what we know about the virus, what we don't know about the virus. And both the people that I'm on the videos with and myself are getting a lot of sort of political kickback. And I'd like to spend a little bit today talking about the futility of attacking this from a politics standpoint, and ascribing political intentions to what I'm saying, because there definitely is no political intention, but that doesn't mean that you couldn't build that in for yourself. It makes no sense to attack me personally or politically about what I'm trying to say, because all I'm trying to cover is data. And if you're nasty, I won't respond anyway. If you have a valid argument, I'm completely willing to listen to other people's data. If I've missed something, if I've misinterpreted some data, I'm open to learning. I reserve the right to be wrong about everything I'm saying. This is simply my opinion. So let's talk a little bit about politics. And there's a lot of politics about whether or not the disease is worse than the cure. So an overarching theme of everything that I'm saying is that we have to define every term that we're using. And so what do we need? What do we mean by disease, and what do we mean by the cure? The governor of New York claimed that the disease was death. I don't think the evidence supports that. The evidence supports that there's a definable mortality, death rate to the virus, but the virus is not synonymous with death, obviously, since the vast majority of people do not die. And we'll talk a little bit about the same data that we always talk about. And so if we say, well, the disease is therefore a COVID infection, it's still not 100% clear, because it depends on what you mean by COVID infection. How are we testing for that? Are we presuming it? Are we actually testing? Is it PCR? Are we talking about antibodies? What type of test are we doing? And what is the sensitivity and specificity of the test? We don't really know the specificity really well. So are there a lot of false positives or false negatives? Well, we have to know the prevalence to know that. And we're just now starting to get some idea about that. So in other words, we are making up a definition about what the disease is. And I think the argument, if you take out the media talking points and the spin, I think the argument is that the disease is COVID infection deaths. And the cure for the COVID infection deaths does not exist. So the cure can't be worse than the disease, because if the disease is death, then the cure can't possibly be worse than death. But it could be. I mean, you could suffer for a long time, and that could be worse than death. But if we're measuring how many people are dying from this, we're saying that's the disease that we're trying to cure. We're trying to minimize the number of people, and cure is the wrong word, right? What we're really trying to do is mitigate the deaths. And what we're trying to do with the mitigating the deaths, but the media is not going to use the word mitigate. They like sound bites. So is the cure worse than the disease? Well, the disease is how many people are dying. And the cure, if the disease is how many people are dying, then the cure is how many deaths can we prevent? And to be clear, the reason that we quarantined, and the reason that we sheltered in place, and the reason that we wear a mask, and the reason that we social distance, and the reason we pulled our kids out of schools and shut down businesses was not to cure how the virus is killing people. That has nothing to do with how the virus is killing people. What we're trying to do is prevent the overwhelm to the medical system. So if we're totally honest, the disease was overwhelming the medical system, and the cure was not overwhelming the medical system by sheltering in place, preventing how quickly everybody gets infected. Now, there's a really good chance that everybody is going to have to be exposed and infected by this virus to some degree. And the good news is 99% of the people won't get severely sick, won't get super sick. Probably over half of people won't even know they've been exposed to it or, infected by it. So if we're looking to whether or not we should be doing what we're doing, and this is, outside of my expertise, but should we be sheltering in place? Should we be wearing masks? Should we be wearing gloves? Should we be social distancing? Again, I'm not a policy person. Does the data support that? Probably not. That's what I've been trying to say. So when I'm comparing this to the flu season, I'm getting a lot of kickback on that as well. Saying, talking about how this disease behaves differently, how the virus behaves differently, how the symptoms of the disease are different, all of these things. Lots of other attacks on my logic. I'm not comparing the pathogenicity to the flu, right? The pathogenicity is simply the property of being able to cause disease, right? So it is able to cause disease. Does it cause it more quickly, more severely? Is it more contagious? I'm not addressing that, right? I'm addressing the historical data of the flu and the number of people that have died from the flu every flu season. There's also there's also a term called pathogenesis, right? And the pathogenesis is how it causes disease. I'm also not addressing that. And the pathology, I'm not addressing. The pathology would be the features of the disease, right? The pathology of the disease. What does it look like when we test it, when we look at it on imaging, when we look at it under microscopes? What are the clinical symptoms of it? That's all the pathology of it. I'm also not arguing that. I'm not trying to say that this is the flu or that this is related to the flu. I'm trying to say that this is an influenza-like illness. That it's a lower respiratory illness, and it has a property of infecting people and causing illness and causing death. And I'm not saying it doesn't exist. I'm not saying none of these things don't happen. What I am saying is that we don't know enough about this virus to be able to cure the virus or treat it to any significant disease or to treat it to any significant extent. And that is why everybody is so afraid of this. And as we learn more, it's becoming less scary. In fact, the most recent data out, through extensive testing, antibody and PCR testing, so testing people for the disease and testing to see if people have had the disease, estimates in New York City at approximately 21% prevalence, meaning that 21% of the city, 1 out of every 5 people, has either had it or currently has it, or of course died from it. There's a county in California, Santa Clara, that estimated about 5% of their population had it. And if you do the math of the infection rates and the death rates, or the overall infection prevalence or incident, but mainly the prevalence of the disease, how many total cases have we seen? How many people are infected by it versus how many people have died from it. It's looking like and this is data, this is not opinion. The data currently suggests that the death rate is approximately 0.1%, which is the same as the flu, right? Not all flus are equal. And the argument that I've been making is that when all of this stuff is nebulous, and everything is nebulous right now, right? We talked about just the talking point of disease and cure. What does that mean? But let's even more scientific phrases, right? Like, what does it mean that somebody died from coronavirus? Well, we know that that definition has shifted over time, and that leads to confusion, and that leads to speculation, and that leads to conspiracy theories, and that leads to a lot of political rage and a lot of ad hominem attacks. And I'm not getting involved with that. Just simply saying that the definition of COVID death is not very clear. Some people are assumed to have had it. Some people are tested after their death, and if they have it, if they test positive, they've been declared a COVID death. Some people are clearly dying from other diseases. They were essentially on death's door anyway. They also have COVID. That's being called a death. So we don't know, and it's changed over this past couple of months. It's changed what we've been calling deaths. And this is very provable. You can look at the CDC's guidelines. This has shifted over time. So it's nebulous what the death rate is, what the death total is. But we can either trust some of the data or none of the data. So we don't get to cherry pick and say, well, we think that China's data is wrong, or we think that Italy's data is wrong, or we think that New York City's data is wrong, and we're going to believe everything else. We either believe everything or nothing. And so if we believe everything, we look at the fact that worldwide we've had about 208,000 deaths to date. And this is going back to China's first death. If you look at the Worldometer's page for total deaths worldwide, that's 19 million people have died since we started tracking coronavirus deaths. And if you do that math, it's about 1% of all deaths have been from COVID or attributed to COVID, however anybody's defining it. And again, it's not the same from country to country, and probably even county to county or hospital to hospital. There's some variation in that. It's a bit nebulous. But if we're just trusting everybody's best judgment to say who has died from it, 208,000 people have died out of 19 million people, which is 1%. You may say, wow, that sounds really high. This is based off of the number of known cases. But if we just say, okay, it's 1% death rate, that seems really high. It doesn't seem really high, though, if you say 99% of all people have died from something other than COVID, no matter how loosely you associate the COVID death toll. So another way of saying that is if there were 100 people and we said that out of 100 people that died, only one of those people died from coronavirus. The other 99 people died from something else. Where are you going to put your focus? And let's assume that maybe 40 of them died from cardiovascular disease and 30 of them died from influenza or from cancer, and whatever, anything over the one that died from coronavirus, it would be more important to put your focus on that, right? Because you have in my example, we have 40 people dying from cardiovascular disease. Well, we should put some importance on that, right? We need to make sure we do our best to maybe take that 40 down to 35, right? As opposed to putting all of our attention on the one coronavirus and say we want to turn that one into a half or a zero. So that gets back to the original political talking point: is the cure worse than the disease? Well, if the disease was overwhelming the medical system, that didn't happen. So the cure for that possibly was the things that we did, all of the social interventions that we did. Maybe that prevented us from having a medical overwhelm. We don't know, but it was avoided. No one has come anywhere close to maxing out their medical capabilities. As you know, New York City had field hospitals and the USS Comfort and all these additional hospital facilities, not even close to overwhelming it. New York is obviously on the decline right now. Lots of other cities have had, Seattle had some field hospitals designed that never saw a single patient and had to be broken down. So we never reached anywhere close to the overwhelm. So it looks very unlikely that we will. So if the cure was to not overwhelm the medical system, we succeeded. The question is now, what does that phrase mean? Now, what is the disease and what is the cure? Well, currently the disease is the toll to everybody's lives, the toll to all humans. And so there's financial disease, there's social disease, there's medical disease. And so now we have to balance all of those. And what is the cure for all of that? Well, we don't know that either. We're working on that. They're smart people, way smarter than I am, who are working diligent in their area of expertise to say, well, how can we salvage the economy? How can we decrease the social impact? How can we decrease the financial, legal, corporate, small business? Like how can we do our best to improve that? And of course, one of the ways to mitigate against all the disaster in the current definition of the human suffering, how do we ease the human suffering? Well, part of that is, of course, returning to normalcy and getting people back to work, getting people back into their activities, getting people out of the situation that's currently causing them to suffer. And that's nebulous. We, again, don't know how to do that. This is novel. We haven't been through this before. We've never shut down our economy before, and we don't know how to restart it. And that's fine. I'm not saying whether it was wrong to do it or whether it's right to do it. I'm saying that currently our reason for doing what we've done has been met, when it is now time to reassess how we're going to move forward and start reducing other types of suffering while keeping a close eye on the actual infection rate of COVID and whether or not we're seeing a big spike in disease and death. Now, there's a lot of argument out there about how we should be doing that. Should we be contact tracing? Should we be testing everybody? Do we need antibody tests? Do we need PCR tests? And what does testing mean? There's lots of different tests, and testing different populations with different tests would be necessary. So it would be a very complex thing. It's not as easy as just saying we're going to test everyone in America. There's lots of political attack about America being unprepared for the testing, but it's very clear we've tested far more than any other country in the world by a long shot. So we are not remiss in our testing. We simply don't know how to move forward with it, and we're trying to figure that out right now. But the overarching argument here is that something else has to be done. When we were contact tracing in New York, it took like a day or two before we overwhelmed the, this city, municipality, or maybe it was even federal. I don't remember who was doing it, but the organizations that were contact tracing were overwhelmed within a couple of days. That works when a disease prevalence is really low. The incidence is really low. We don't have a lot of cases. It's easier to trace it. Now you have millions of people who have been infected, and they've interacted with millions of other people. We don't have the capability of tracing that anymore. What we do know is that about 20% of the deaths are coming from which I don't know what the phrase is for. We have to call them old folks homes. I know that's not the politically correct thing to say. What am I looking for? Nursing homes. Yeah. So about 20% have come from nursing homes. We know that about 80% of all deaths have occurred, and I think over 70, either over 65 or 70. So we know who's most vulnerable. We do know that, and we can do something about that. We can consider quarantining those people and letting other people develop this herd immunity concept that we've all been talking about. So my overall point is that there is no version of this where attacking other people's narratives with political talking points is helpful. There's no version of this where panicking is helpful. We are past the panic phase. We have enough information to start making changes. This is not binary. We're not choosing we're not choosing money over lives or recreation over lives. We're choosing lives over lives. We don't want to destroy people's financial life. We don't want to destroy people's social life. We don't want to destroy people's physical life. We want to do the best we can as a society to give everybody the maximum amount of freedom, control over their life, to enjoy the life that they envision for themselves. And none of us have the right to weigh in on how anybody else envisions their future life. But we also have the right to not have our lives ended by somebody else. So that can be guarded against as well. So I think I've said everything I wanted to say. Yeah, that's about it. Just remember that the data is, even the best data is still somewhat nebulous. The definitions do have some drift to them. Everybody is trying to figure out a way forward. The only narrative that I am sharing is that, hey, I think this data suggests that we are ready to consider something else. I'm not weighing in on politics. I'm not weighing in on policy. I'm only weighing in on the definitions of the political talking points that I see, trying to bring some clarity to this, that this is actually, yes, it is a disease. It is causing morbidity, meaning it's causing people to be sick. It's causing mortality. It's causing people to die. There is very little we can do about that. Almost everybody in this world is going to be exposed to this virus unless it just peters out for some reason, like no other virus has ever done. There's lots of fear mongering, I believe, and that's a political term, but there's a lot of injection of what I consider to be very rare, exceptional data of people who have been deemed to have been infected and cured and reinfected. I can say that there's not enough data to say whether or not that's true. If that is true, there's nothing we can do about it. It obviously means that a vaccine will never work because the vaccine would have the same problems. And it would be the first case that we know of any virus, not having any sort of immune protection to the exact same virus. It might not be the first case, but it would be exceptionally rare. I can't think of anything else that would be that way. So again, my only point is there's no reason to panic. If we look at historical precedents, the most likely thing is this is going to become part of our flu season, is going to cause an overall death rate that is somewhat similar to the flu. The area under the curve, meaning the total number of deaths over a finite amount of time, is probably going to be in line with a flu season. This seems very contagious. It doesn't seem to be any more deadly than the flu with current data. That could change. But again, no version of this, no version of the future exists where you'll say, man, am I glad I panicked. Panic by definition is a non-useful state. It's an emotion. And I think we're better off just looking at what we know, as limited as that is, being realistic about what we do know and what we don't know, being clear about what our definitions are of the data that we're using, and then putting data into models instead of assumptions. When this whole thing started, we were assuming, we were guessing with really big, broad guesses that the R naught was something between 2 and 5. Well, that's an astronomical difference when you're looking at, exponential growth. That's a huge difference. When we're looking at originally a death rate of somewhere between 3 and 6%, both of those are huge. It's definitely less than 1%, and very likely it's close to around 0.1%. So, for the time being, be a good citizen, take care of your own health, make sure you're sleeping well, make sure you're eating well, make sure you're exercising, make sure you're controlling your stress. And part of controlling your stress is controlling this narrative. If you don't like my narrative, all you have to do is not listen to my narrative. I'm not telling you my narrative is correct. I'm simply sharing it in case anybody finds it interesting. So I hope somebody found that useful, and I will babble again tomorrow.